Good morning. In the last class, I discussed the inguinal lymph nodes, and today I will discuss another group of lymph nodes, that is axillary group of lymph nodes. This group also very important from examination point of view. Sometimes short note may come from this topic and the drainage area of the axillary lymph nodes. And usually the number of axillary group about 20 to 30 lymph nodes are there, but they are arranged in different groups, and here the groups are: one is central group, then anterior group, then lateral group, then posterior group, and last but not the least, or rather most important, is the apical group. So there 5 groups are there. In these 5 groups, the 20 to 30 lymph nodes, they are distributed. If I ask you, can you tell me the number of lymph nodes present in the different groups? Very easy to remember. If you start with the central group, the number 3 to 4, anterior 4 to 5, lateral 5 to 6, posterior 6 to 7, but the apical group about 6 to 12. Just you see the order 3, 4, 4, 5, 5, 6, 6, 7. Very easy to remember. And if you like to remember the groups, you take the first letter C, A, L, P, A. C, A, L, P, A. Kalpa. So there are so many meaning of the kalpa is there. I am telling you just one meaning of the kalpa. China Airline Pilots Association. China, I am writing here, China Airlines Pilots Association. So this C for central, anterior, lateral, posterior and apical here, and their number of lymph nodes present in the different groups of axillary lymph node. Now, the name of the different groups indicates that the axilla, it is triangular or it is rather prismoid shaped, having one apex and 3 walls are there. I am showing you. Suppose this one. You see this one? This is one surface or one wall. This is another wall. This is another wall. So 3 walls are there, and one is the base, one is the apex. So axilla, it is looks like this. Base is downwards and apex toward the cervical axillary canal, through which it is connected or communicated with the root of the neck, the apical part, and this basal part towards the base, that means forms the floor of the axilla. This one. So 3 surface, 3 groups of lymph nodes: anterior, posterior and lateral. I told you there are 5 groups: central, anterior, lateral, posterior and apical. I told you. So here is the anterior. If the anterior surface, anterior wall of chest, pectoral region, here you will get the anterior group of lymph nodes. Then This is lateral group of lymph nodes. This is posterior group of lymph nodes. So lateral group, posterior group. And apical means this is the apical group of lymph nodes. And central, they are present close to the base, basal region, central. So if this is the central region here, then others are anterior, then posterior and lateral, and here is the apical. Here is the apical group. So all the lymphatics from the anterior, lateral, posterior, they reaches the central group of lymph nodes. From the central, they reach the apical group of lymph node. But from the anterior, they may reach the apical directly, but usually the efferent from these lymph nodes, they reach the central group. From the central group, the efferent of central group reaches the apical group as afferent of this apical group. Then what is the drainage area of these different groups of lymph nodes? It is very easy, not so difficult. Suppose anterior means this is the anterior region. So the chest wall from the anterior side, including the breast, and the lower part of the chest wall and upper part of the anteroabdominal wall up to umbilicus, not below umbilicus, up to umbilicus, they reach the anterior group of lymph nodes. Then posterior. Posterior means this one, back side. So the back of the trunk up to the iliac crest reaches the posterior group of lymph node. Then lateral group. Lateral group means the lymphatics from the whole of the upper limb, except the lymphatics along the cephalic vein. In the lower limb, we have seen the whole of the lower limb lymphatics from the superficial part. It goes up to the vertical group of superficial inguinal lymph node, except the lymphatics along the small saphenous vein. And here, all the superficial lymphatics, they reach the lateral group of lymph node, except the lymphatics passing along the cephalic vein, which reaches directly with the apical group of lymph node. But others, they reach here. So drainage area, just I am repeating once again. Listen to me carefully. Anterior group receives the lymphatics from this side. From this side means this is from the pectoral region, from the breast, and from the lower part of the thoracic wall and upper part of the abdominal wall above the umbilicus. Anterior. Posterior means behind the trunk up to the iliac crest on the back. Lateral group, whole of the upper limb except the lymphatics passing along the cephalic vein, and that lymphatics which is passing along the cephalic vein drains into the apical group of lymph nodes, and all these three lymph nodes, they are draining into the central group of lymph nodes. So all these are the efferent for these groups and afferent for central group. So there are so many afferent for central group, and these are all afferent for the different groups. The efferent from the central group, they reach the apical group, and apical group also receives the lymphatics from all other three groups and lymphatics from the upper limb which are passing along the cephalic vein, and some lymphatics from the upper part of the mammary gland. So these are all drainage area. Suppose a question may come in theory paper or may be asked in the Viva examination. Suppose one infection in the mammary gland or in the pectoral region, which group of lymph node will be affected? If you know it is anterior group, so anterior lymph node will be affected. Among all these group, the central group is one of the important lymph node group, because this is the drainage area of different lymph nodes, and also one nerve is passing through this lymph node. That nerve is the intercostobrachial nerve. This intercostal brachial nerve supplies the medial side of the arm, upper arm. So any involvement of this nerve may cause pain in this arm region, and the involvement of nerve means this is due to the involvement or enlargement of the central group of lymph node, which is causing compression on this nerve and resulting in pain. And that enlargement of the central group of lymph node may be due to the diseases or malignancy of its drainage area, particularly the mammary gland in case of female, or maybe some other regions as well. So that important applied question usually comes in the examination. So you must remember all these aspects of axillary lymph node. You first write the different groups of lymph nodes and the probable numbers of the lymph nodes in different groups and total number of lymph nodes in the axillary lymph nodes and their drainage area and the applied importance of the drainage area, and you draw a diagram in schematic way and label it. So thank you very much for today. If you like this video, click on the like button and share it to your friends, and of course subscribe it. Thank you.